Hi everybody, it's me, Dr. Kestler from Lorain County Community College with today's co-video. Today is April 15th, which is supposed to be tax day. And I always tell my students this. I'm just going to say something that I always say on this day when I am giving a lecture to students. And then I always say, this is the day that I cheerfully pay my taxes. And the reason that I cheerfully pay my taxes is because I'm quite thankful for a couple of things. One of them is the Centers for Disease Control. And Centers for Disease Control is an awesome organization that is designed to protect us from all sorts of problems. If they're doing their job, you don't know they're doing their job. That's one of those things that they do fantastically. And the other one is Medline. And Medline is the National Library of Congress, National Medical Library. The best medical library in the world is available to you. And also GenBank. GenBank is also part of that whole system where we keep all the DNA. I'm going to have a lot to say about genetic information today in today's co-video. First of all, let's start with my temperature today. I am 95.9 degrees Fahrenheit. If I ever get much higher, it would be a surprise to me. All right, I want to talk about a couple of things. First of all, yesterday I mentioned something about mental illness, and this is a serious problem. This is a paper that was written by a resident in Michigan, in Detroit, and it's just a terrible story about how somebody is dying alone. This is the way that COVID-19 is in our country. We have people who are dying alone. They're dying by themselves, and I think that. One of the things that I can tell you is that there's a technological solution here. So I would just appeal to the good people at Apple and Google to try to pitch in on this kind of an issue. Certainly, we are in the middle of a lot of people dying, and it would be good and dying alone. Unlike if someone's dying of a heart attack, they could be surrounded by family, but in the case of COVID-19, they cannot. And so I think we need to think about this. And I would just remind you that there is a storm coming. A mental health storm is coming, just like the disease was coming, and that will be one of the aftershocks that occurs after this is all done. Second thing I want to talk about, this is also from New England Journal of Medicine this week, and that is about why we need the FDA to be the way the FDA is. And the FDA is the way that they are because they evaluate things, they dot their I's, they cross their T's to make sure that they're doing something really, really useful and not just responding to, let's say, a hunch, that they're actually responding to something that is based on science. And I'll remind you of why they are particularly, and I think I've covered this already, but I just want to go over again, why they are such sticklers. The FDA is such sticklers for detail because of thalidomide. And the thalidomide occurrence was, thalidomide was a drug that was used, it's an anti-nausea drug, and it was used for, it was used to treat nausea. And of course, who has nausea? Pregnant women. And so it is also was discovered, was discovered, is also a teratogen, which means can cause birth defects. And of course, that is why the FDA is so very, very much a stickler for details. And so I think that's why we are making sure that when we say something does something, it does something, and we've evaluated all the side effects and we're good to go. I'm going to talk more tomorrow about Ohio. I just wanted to throw something out here that I was confused by. I was looking at the Ohio website for the different cases, and I'm noticing that there is a lot of a lot of cases, a lot of deaths have occurred. Most of the deaths in Ohio have occurred in Mahoning County, even though they are 1, 2, 3, 4, 5 down as the number of cases. I don't know if that's a result of more people being infected than are being tested. I don't know what's going on there. It could be the age population. Ohio in general has a rather elderly population, so that is something worth looking at in the future. All right, for the rest of the time, though, I want to talk about this paper. And this paper is fascinating. In fact, those of you who are students of mine, this is a little bit of a preview because I know in my infectious disease class, we're going to be talking about this in tomorrow's webinar that we do on Thursdays. This is about the SARS spreading, about SARS-CoV-2, which is COVID-19. COVID-19 spreading in the Icelandic population. And they have done an amazing job of screening people. They've screened people in a couple of different ways. One was targeted testing. So you are getting tested because you are somebody thinks you need to be tested. There's you have symptoms, etc. And there were a whole bunch of people who were tested. And then there were people who they just randomly identified, and then there was an open enrollment, and then there was some that were randomly invited, specific targeted people. And what they found out was that there was a low level, and when they randomly went out there was a low level, and there was quite a few when there was a clinician was suspecting COVID-19. There was a good number of them. And then they went through a screening. One of the things that they also did was, which was very fascinating, is that they also did DNA sequencing. So they did a lot of DNA sequencing of all of the isolates. They even noticed a Icelandic isolate, a version. There was a particular mutation. And they were, I'm not going to talk about this part, but they were actually able to see where virus came into the country. But what I really want to focus on the bottom of this this flow chart here, you can see contact tracing. And contact tracing is something that we're going to need to be able to do going forward. We're going to need to be, where have I been? Who have I been in contact with in the last 5 days or so? And that's going to be, let's say I become positive today. Where did I go? Where have I been? Who did I come in contact with? Who do I need to tell that they are at risk? And that shows you the next slide here. And this is a little bit more of a complicated thing, but basically what I can tell you about this is that they had identified, if we go to panel B first, they had identified some isolates that came into the country through Italy and through Austria. Those were the travel-related cases that came into Iceland that they were able to identify from their database. And then if you look at panel A, it shows you contacts, and anybody who has a line associated with them is how that contact went through the population. So you can see some people spread it to another cluster of people, to family members, etc. In the next slide, they actually are showing you how they divided up the data, or how they looked at where the contacts were coming from. And this is rather instructive for all of us to know where our contacts are coming from and where it's going from. First of all, if you look at the beginning, let's go to the panel B first, where there's an absolute number, and we'll go to the top part, rather. We'll go to the bottom part of this panel first, and then we'll cover the top. The bottom part of the panel shows you where virus is coming from. First of all, it starts out being imported, people traveling in to the area. And then there is other kinds of contacts that are listed on the right-hand side. There are contacts that are listed, such as family, such as unknown contacts, which is a considerable, sometimes you just don't know where things came from. There is social contact, tourism, which I assume is that you somehow work where people who travel come to see you. And then there is work and and then travel. You'll notice that in the initial outbreak, which this starts in the early part of March, you can see that most of them are coming from outside. These are cases that are coming in. But as time goes on, you can see a greater and greater proportion are being transmitted through family, transmitted through social contacts, et cetera, et cetera. This gives you a great view of how this disease gets spread. It gets spread through family, it gets spread through social contacts. So we are going to be socially distant for a while. We're going to be at a distance from each other for a little bit of time here. So we'll need to get used to that because it does seem to be something that we can control. And we are going to need to isolate people very carefully going forward. I mean, everybody is talking about what is going to happen next. What is going to happen next? Right now, I think everybody has to do their best to plan on what happens next. So how are you going to do? And the governor's report, that's Governor DeWine from Ohio's report yesterday, he said that we all need to have plans. Universities need to have plans. Colleges need to have plans. Schools need to have plans about what you're going to do differently going forward. What is it going to be like in the upcoming fall semester? How are you going to plan for keeping everybody safe, keeping people safe? And I think everybody has to think about that. I know one thing, before we had the shutdown, restaurants were thinking about, well, maybe I'll take out extra tables, or maybe I will, go 50% of the fire code number, in those kinds of ways to cut down contacts. Clearly, it is contacts that do it, and we need to plan for that eventual event. I'm going to leave you right there for today and say, be good to each other, and be the helper. Everybody should be the helper. We all need to start thinking about how we are going to conduct ourselves going forward, instead of asking people, when is this over? What are we going to do when the initial emergency is over? Because there is, if we have a good number of people who are still uninfected, unexposed, there does exist that threat to the population, and we need to plan for that. So be good to each other, and may you persist like a lentivirus. Thank you for tuning in.